Welcome back, everyone, to the Burnout Club. This is a place where we explore burnout and success, one expert and experiment at a time. I'm your host, Patrice Bonfiglio, and today I am rejoined by Neal Shah. This time he's putting his other hat on. He's the chairman and co-founder of Counterforce Health. So welcome back, Neal.
Hey, Patrice. Thanks so much for having me again.
Yeah. So this is the second part of the series that we're doing on healthcare and really the care economy. And no shocker here, there's a lot of problems. There's broken systems, and that leads to burnout. And Neal is actually doing something about it. Not only is he just completely changing lives and families with Care, he is figuring out ways to help people fight insurance denials. And I won't spoil it too much, but Neal, why don't you give a little intro on what Counterforce Health is?
I'll give you a very graphical preview of what's going on. So this is a book I just put out. Happy to send it to anyone for free. I mean, it's available on Amazon and Barnes & Noble, but we're not making money on it. So I can just share anyone a free version. But the graphic illustrates the book is called Insured to Death: How Health Insurance Screws Over Americans and How We Take It Back. As you can see, this is what I believe is happening across society. The denial letter from the insurer represents the shadow of a gun. And, I think that, while it's a little bit of a jarring cover, this is the crisis that I feel is facing patients and, families across America. Insurers are programmatically denying absolutely critical care, and that is creating a massive, massive financial and stress on a burden on patients who are already suffering and fighting illness and their caregivers who are usually their family members. I think it's become an absolute nightmare over the last few years. So I wrote the book, as not just kind of here's a problem, because I think there are a lot of problems and people are aware of it, but here is a problem and here are solutions. I really wanted to empower patients and families who are going through this that they're not powerless. There are things they can do individually, to kind of reclaim their rights and reclaim their agency to get the care that they need. And there are things we can do, as innovators to help people. And then there's something we can do as a society through advocacy and building a grassroots movement to actually fight back and fix and really change the system for the better. So I think this is one of the biggest epidemics of our times. And, I'm really excited for the opportunity to talk about it.
Yeah, I love the intro. Right into it. And there's a reason why the book is a bestseller, because it's such a huge problem. Not that it's only a large problem in terms of the amount of people that is affected, but the severity of the issues that are caused. And I was shocked at the numbers of denials out there. And I think it's 1 in 5 in-network denials. And then, tell me if I'm wrong there, but just talk about the scale of what's happening, if you can, for a second.
1 in 5 adults in America has been denied a health insurance claim in the last year. That's 1 in 5. That's absolutely shocking. Almost 50 million people have dealt with a denial. There's 850 million denials last year. So it's also the same people are getting disproportionately impacted over and over and over. The people with major illness, the people with disability, the people living with cancer. Some of these people are facing multiple denials over the course of a few months or a year for, common surgical procedures, for hospitalizations, for critical medications. It's over $1 trillion, of denied claims. I mean, it's absolutely tragic. And, this wasn't always like that. And I think that's really critical for people to know. Yes, insurance is a business. And, yes, insurance makes profits, where they collect premiums and then, they don't pay out all the premiums in care. And that's the whole business model, right? But, we've talked to tons of people in the insurance industry, and I did extensive research for the book. The denial rates at many major insurers, as recently as 10, 15 years ago, were around 1%, 2%, maximum of claims denied. In the last 3 to 4 years, they have skyrocketed to the point where many major insurers, household names you guys might be familiar with, are experiencing 20 to 30% denial rates. I mean, it's absolutely absurd. Wow. I have a lot of theories of why that's happened, but I just think that this is a problem of last few years. This was denials were always a thing, but I think skyrocketed and escalated in part with insurers kind of exercising greater monopolistic or oligopolistic power in their industries and having tremendous amount of vertical and horizontal integration that's happened over the last decade. And I think that there's no check on them. If they deny something and you fight and you ultimately end up getting it, no loss to them, And then if they deny something, most of the time people don't appeal. So then they walk away with keeping the money. That was actually one of the interesting statistics and reason that we shifted into this line of work is that of patients who are denied care, 99% of people don't bother to appeal. They don't know their rights. They're intimidated.
Yeah.
They're like, what should I do if I try to write something? I'm not a doctor. How am I going to get this, get it covered? Of the 1% that appeal, 50% of people win at baseline. So that's like, first of all, unbelievable statistic, right? That basically read on that my two takeaways on that are, one, it means a lot of denials are frivolous because if you're overturning half of them when somebody says, hey, this is incorrect, then you're frivolously denying too much. And then two, it's that this is a public service issue, public service announcement, want to scream on the rooftops, anyone who's dealing with denial, please appeal. You have a decent chance of winning. And then the better you make the appeal, the more likely you can win. So I think we need to get people, educated and aware that they have agency in this matter. They have rights, and there is a robust series of processes available at their disposal to fight back and get the care they need.
Great. I mean, it's shocking. Not only just going back to what you were saying, that it wasn't like this just a few years back. I didn't realize that. That is shocking.
Yeah.
And I think that will light a fire and make people really understand we still can actually, we can go back and fix it. And also the fact that there's so many, probably just administrative, super technical, but non-medical reasons why these denials are happening. It's, that part is scary. So hopefully anyone that's listening right now that has a denial, just get ready right at the end of this podcast. Start working on your appeal. So you have a solution to help them actually appeal. Can you talk a little bit about Counterforce Health?
Yeah. I'll talk a little bit about that, and I'll also, kind of like elaborate on the point that you just made. Part of the reason why I think it's skyrocketed in the last few years of denials is AI. Let's call it what it is. AI is a new technology, and in studying technology over human history, oftentimes when a new technology comes out, bad people first use it for bad means. And then it takes a while for good people to use it for good means. Usually like, in this case, and I don't want to villainize anyone, but let's just say, yes, I will villainize health insurance companies. But basically, they jumped into this technology because they have a lot of money. And over the last 3 or 4 years, they started programmatically denying claims. You can put an AI system on it. A human doesn't even have to sit there and deal with the emotion of, I am a doctor at an insurance company. I'm denying this cancer patient care. That feels bad. And, people might hesitate in frivolously doing that. The AI doesn't hesitate. So, we've had, and I covered a lot of these instances in my book, that there's AI systems that are denying claims at 1 second on average of review. I mean, it's like no one's even looking at it.
Wow.
So, when you have this asymmetric battle, and, not to name names, but there's like tons of news stories on this, like the CXDX algorithm. That was like on average 300,000 claims were denied an average of 1.2 seconds each, by an insurer. And, when you have that, and then the patient or family experiences an algorithmic denial, and they have to spend 8 hours, 10 hours crafting a super detailed appeal letter, citing medical necessity, pulling references from academic research journals, parsing through their entire coverage policy and their medical records, going through billing code databases. This creates an enormous administrative burden on people who are already sick and suffering or who are taking care of their loved ones, that many people just tap out and say, I don't want to deal with it. I'll go without the treatment, or I'll just pay out of pocket to get it. None of those are great outcomes for anyone. So, turning to your point, that's why we built a solution. We thought that AI had been weaponized by the insurance companies, and we're like, okay, you know what? It's time for somebody to weaponize AI back to arm patients, to arm small clinics, to arm people, to fight back against, this like really terrible system that is denying people care algorithmically. So, we built a bunch of free AI tools. It's been like months and months of effort, lots of training, lots of testing, iteration, and they're hosted on our site, free for anyone to use, counterforcehealth.org. And, thousands of patients are using them, hundreds of clinics are using them. We're having hospitals reach out. It's been really interesting to see. But I think this is sadly, it's a battle of AI versus AI. And over the last few years, it was a battle of AI versus manual. And there's no way you can win, so that there has to be kind of AI systems to do this work for you. Not only reduce your 8 hours into 2 minutes, but actually improve the quality as opposed to if you did it yourself. And that's kind of, I think, the power of AI is that it can do this very methodically, parse through hundreds and hundreds of pages and pick out all the relevant things, learn from doing of what's the best way to win, both persuasive strategy as well as like the relevant citations. And it's as if you had a friend who's a doctor who spent 10 hours, helping you. So that's, I think, really the benefit of how we can leverage AI to help people.
Yeah, that's just amazing. And I want to highlight that it's not just the patients and the caregivers that are reclaiming the time back, but the physicians that have to spend so much time on these denials as well and crafting things and figuring out alternative care plans. So the doctors that are actually working on us to maintain our health are going to be a bit healthier and a little less burned out because of this. So that's a great advantage.
Thank you for mentioning that side. Patrice, I think that the burnout from clinical careers, number one cited reason is insurance and administrative paperwork. I've talked to so many doctors, so many nurses. In the Care AI platform, we have over 40,000 healthcare students who are caring for people in their community, which we talked about in your other episode. And many of these students say a big fear of theirs is not that they want to go in medicine and help people. They're excited about the journey. They know school is going to be hard and all that stuff and residency and all that. But they're really worried that, am I just going to become a paper pusher and a slave to the insurance company? And I'm not going to be able to practice healing, which is why I went into this in the first place. The insurance companies have fully taken over, corrupted and co-opted the practice of medicine. And that is leading to a lot of wonderful people who are very mission-driven, who are burning out in extremely large numbers. I mean, we've already had this, prior to the pandemic, a lot of doctors and nurses were getting so overburdened. Pandemic certainly accelerated a lot of that. So you see our healthcare workforce, is declining. A lot of nurses are leaving. A lot of doctors are leaving, nurse practitioners, PAs, they're kind of going and doing something else. And it's a waste of human talent and potential. And it's because the insurance companies rule this, and the insurance companies waste so much of providers' time. So, there's a topic in researching the book that I learned, and I wrote extensively about this in the book called moral injury. And it's really afflicts a lot of healthcare providers when they go into it with very strong sense of morals and ethics. I want to help people. I want to heal people. I want to help the sick and suffering. And then you go into it and you're like, okay, this person I know needs XYZ surgery. I know they need XYZ drug. This is the only way to heal them or make them better. And the insurance denies it. And then you start trying to fight. And you're like, well, I'm going to write these letters. I'm going to call. I'm going to do XYZ. First, it takes an insane amount of your time. And you don't have unlimited time because you have to take care of other patients. Sometimes you do it. Sometimes you don't do it. Sometimes you have to do it. The more you see the people are not getting the treatment and the care that you think is best for them, the more you start having a lot of these moral dilemmas and really what moral injury, that I am not actually able to help the people that I'm supposed to help. And I know how to help them, but I can't help them because some Kafka-like administrative BS system, which is health insurance, has now become your overlord. And then at some point, you're either going to sit there and deal with that, or you're going to just get kind of like so burned out and just say, okay, you know what? This is way too stressful. I feel so sad every day. I can't help the people I'm trying to help. Let me go do something else because I can't take this anymore. And I think that is a tragedy, right? It's like, let's put the health insurance companies out of business before we allow all these millions of wonderful healthcare people to just kind of like leave their careers, So I think that sadly, government has not regulated this well. I'd say it's fully a fault of government, and it goes bipartisan, right? We've had Democratic administrations and Republican administrations and all these states and everyone across the board for the last 15 years. And no one has really paid enough attention. And now I think the crisis has gotten absolutely out of hand. The moral injury and the burnout of healthcare providers is one of the saddest things about insurance denials. Number two, to the fact that tons of patients who are sick and suffering are having to fight and deal with this BS. So I think both of those things require solutions. And, our solution is like a way to accelerate their time and energy to help. But I think also we need a system-wide solution and better regulation.
Yeah. Do you think that the health insurance industry is beginning to change, or at least listen to your viewpoint and the entire community of patients, especially in the light of the United Healthcare CEO, right? Obviously very tragic.
But question. No, I think absolutely not. I think this is a mafia. And, I don't advocate for violence by any means, but we all know what happened, right? The CEO of the largest health insurance company in the country got shot in broad daylight, 6 months ago or so. Very few people had, kind of support for that. And I think you saw millions come out of the woodwork and saying, hey, I'm dealing with this. What was the response? 6 months of mafia tactics, absolute suppression and intimidation. New York Times ran a major expose 3 weeks ago, and it was eye-opening to everyone that these guys not only responded to that by thinking, hey, why are patients suffering? What are we doing wrong? They responded to that by bullying, strong-arming, suing anyone in the media that was saying anything, and just running a massive pressure campaign. Thankfully, New York Times blew the lid on that in mid-July. So now it's gloves off. And thankfully, a week after, the Department of Justice disclosed a civil and criminal investigation into United Healthcare.
Wow.
So my personal opinion, I think some people are going to be going to jail. But no, I think the industry is absolutely not proactively reforming. I think, if anything, they're digging in their heels. And I think it's time now for the population to step up and do something. And I think it's finally time for the government to step up and do something. I'm actually, the most encouraging thing I've seen is finally the government is doing something. The Department of Justice is now doing multiple investigations at the federal level. And I think now a lot of states are likely to start doing something. So I think this is kind of a classic case of massive corruption, intimidation, extreme concentration of power that then gets so powerful that it does not listen to the needs of the people it's supposed to serve and just purely fulfills its own ends. And then finally, so many people get fed up and agitated that, the mass finally starts doing peaceful, legal and regulatory investigations to change the system. But no, I don't think the industry is doing anything. If anything, the industry has become even more entrenched, since the incident in last December. So I think it's time for people to step up, and really drive social change. It's absolutely top system.
And that was going to be my other question, really. It's that, you've created something to fight, right? So what do you think is going to be the scenario, let's say in 5 years? Like, is it still fighting the same fight, or is it fighting and then there's policy change or some other change structurally that can mitigate some of this?
Yeah. I mean, so a great question. I wrote about this extensively in the book too, and I think I kind of tried to lay out some policy solutions. I'm not a policy expert by any means, but in my dream scenario, there would be a greatly, greatly diminished role of for-profit health insurance 5 years from now. And that can go one of two ways, and I'm kind of like, agnostic to those ways. I could see the pros and cons of each. So in one potential scenario, it is government becomes the insurer of last resort. I think there's some good and bad with that, but at least the profit motive of denying people care so you can pocket the premiums kind of goes away, right? It's like, it's almost like whether it's regulated utility, which is like the way, think about like, government runs your fire department, right? Imagine, back in the day, they used to have private fire departments, but who are they going to, if you have a fire, they're going to ask you, how much can you pay? That's not the right way to do emergency services, right? And, same with your utility, whether it's your electricity or water, these things are kind of like regulated utilities because these are things you need. And you can't just like charge people an arm and a leg for these kind of services because people actually depend on them to survive. So I think there's been that path, where there's like a little more thoughtful regulation. I think there's a path for government just doing it themselves. And then I think there's a third path, which I'm more of kind of a free markets and just freedom oriented person. And I think the path would be diminished role of health insurance, people getting similar tax benefits for funding their own savings accounts, and for people of lower income to get those savings accounts funded through government, and then people self-directing their care by paying directly to doctors and healthcare providers and just fully getting rid of the middleman, and then having a middleman that's just kind of like catastrophic coverage. So I think kind of like self-directed care, health savings accounts, and then catastrophic coverage is backup, likely provided by the government or private insurers. Well, where I'll say this, which is kind of interesting because I see both sides of it. Like, I'm very free markets oriented. The current healthcare market is the last thing from a free market. And I think this is critical for any kind of like people out there who are investors or capitalists who may be like, oh, free market loving. If you're free market loving, you should hate the health insurance market because it's a freaking regulated oligopoly with insane barriers to entry. 2 or 3 companies control most of health insurance in most states across America. There is insane amount of vertical and horizontal integration, which has created kind of like lack of antitrust enforcement and just like major quasi-monopolistic power at a handful of companies. And I think it's been a complete failure or oversight of antitrust regulation. And that's not capitalism. Capitalism is free competition. It's using creativity and forces of creative destruction. And really, capitalism is consumers like who they're dealing with. And in this case, Look at the NPS scores, the net promoter scores of the large health insurance companies. They're negative. Consumers don't like these companies, but they don't have a choice. Like if I want to start a health insurance company, I can't. It's like too many regulatory barriers. So I think this is like a completely broken industry that is anti-capitalistic at its core. And it's not adding value to society. It's only extracting value for itself. And I think that, my final point is the good part of capitalism is where companies add value to society. And if somebody adds $100 value and they capture 20 for themselves as profit, good for them. Good for everyone. Everyone's better off. There's extractive capitalism, which is where the company adds no value and takes 20 for itself. Or the company adds negative value and takes it for itself. That's what I believe the health insurance companies are doing. And I think when you have extractive capitalism at this large scale, what I fear, I'm a middle-aged person, I fear that it makes many young people think, oh, why don't we just go communist? And this is kind of the disillusionment with capitalism that we're seeing in our society is when BS like this is allowed to perpetuate at massive scale. Because then it makes people think capital equals bad. And okay, let's go for another. And I think we really need to think about that as a society if we want a free society. We can for things like this.
I mean, that's a fantastic point, right? So is something masquerading as capitalism, and is there a lack of knowledge, just generally to understand the difference between all of the different isms? I agree. That's a very fair point. Maybe you could start like a civic education platform too.
I really believe like there's a decline of trust in our institutions, and it is very sad because I see many young people. I work with many young people, and they're very disillusioned, and rightfully so. The institutions are not serving the needs of the society, and many of them think, oh, let's completely overthrow the system and do another way. And I'm like, okay, well, if the system can't reform itself, then you'd think it is logical for people to think that. But I think that this is where a system needs to be reformed. Otherwise, people just become disillusioned and give up. And then you'll have anarchy, or you'll have like a nihilistic attitude towards the world. So I spent a lot of time thinking about like decline of trust in institutions. And I think it's on us as, kind of like older people in society with like some responsibility to show that there is a better way forward and institutions can be built with high trust.
Yeah. And to your point that you can't just start a health insurer, because of the barriers to entry, are there any interesting avenues or ideas for someone with capital to try to do something innovative or disruptive, similar to yourself, right? You've obviously been quite busy building solutions. Any other ideas on the hopper that either you will do or someone else can take and run with?
Yeah, I've seen some like promising innovation attempts where, because the regulatory barriers to starting an official insurer are so high, there have been people starting cooperatives where, members fund each other's care. So people pay in, kind of like the way back in the day, like religious cooperatives were for care, of the organization, where there's no kind of profit center, and there just be kind of like a base that adjudicates claims and kind of pays out. So people pay in, and then as you need it, it's paid out. I mean, kind of like in effect to be a nonprofit insurer, so to speak.
Yeah.
So I've seen efforts like that. I've seen efforts where there's some innovative efforts. I'm not sure I necessarily agree with it, but I appreciate people are trying, where people will fund into a pool, and then the crowd will decide from the pool which care to fund as people hit up for claims. Now, there's some pro and con to that, because then you have to like really, it's whoever tells the best story wins. But, I mean, on the one hand, I mean, this is like, I'm sorry, I don't mean to diss anyone. I mean, it's dystopian that this is what's happening, but, it's like I read an article the other day, and I was like, America's biggest health plan is either GoFundMe or TikTok. And it's like, you know what? That is because like that's who's actually paying out. People are, saying, hey, I'm going through this. LinkedIn is becoming this. So I think there are people that try to kind of bring that into a more formal economy. And kudos to them for trying. I don't believe that is a long-term sustainable solution, but this is like what people can do because there's such a barrier to starting an insurer. The best would be, in my opinion, if the regulatory barriers were reduced and removed, and there was a massive breakup of the insurance conglomerates, right? Because like, some of the insurers own pharmacies, they own claims processing companies, they own doctors. Some big insurers employ over 10% of the doctors in America. Can you believe that? So it's like these things are horizontally and vertically so integrated that you cannot compete in those kind of services. So, I mean, it's kind of insane. So I think if there was like thoughtful regulation and a breakup of all these kind of like, mergers or reversal of mergers and allowing of people to start new plans, I think somebody would start a better insurance company and all the consumers would go to that company, and then somebody else would start another one. And, then if one company had a 28% denial rate and another one had a 5% denial rate, everybody would just shift to that company, So I think that when you don't have a free market, this is what people are dealing with. So I see a lot of like innovation on the horizon, but I think probably the most promising is health savings accounts. I see a lot of people just saying, you know what, both on the patient side and the physician side. I see physicians saying, you know what, I'm fully out of insurance. I'm just going to go direct. Now, the problem is you can't serve everyone. So that only starts with people of means, but at least it's starting somewhere. Then I see people saying, you know what, I don't believe in the system as a patient. I'm going to start funding my own HSA and I'm going to go direct. The challenges there still are regulation. The government massively gives tax subsidies, $231 billion a year of tax subsidy for people to purchase insurance, right? The employer or the employee through employer. Why is that so massively tax subsidized? But funding your HSA has massive caps, So I think if tax policy changed and you could unlimited fund your HSA, combined with if government said, I wrote an op-ed about this in US News, and I'm happy to send it to you, but if the government kind of gives a equal playing field on tax treatment of HSA funding, combined with it gets rid of all these subsidies towards insurers and takes that money and says, for people of lower income, government will fund your HSA and just give you kind of money to start the year. Pair it with like a catastrophic coverage, then everybody could be covered. And I think that might be like a better way forward. So I think there's a lot of innovation there, but just like cutting out administrative middlemen who are just extracting value, I think has to be done in one way or the other.
Yeah, I just keep having these images of a huge excavator in my mind as you're talking. It's just like tearing up all the value.
Yeah.
But
here's another image if you want. Parasite, leech. I hate to say it, but this is images of like, and it's like actually, it's interesting when you think about parasitic behavior, right? Optimal parasites survive by sucking enough blood, but keeping the host alive. I believe now in American health insurance and American health care, the parasite is killing the host. And that's game over for both, right? So I think we need to kind of like change the system. It's gotten extremely, extremely parasitic, to a point of insane frustration of tons of patients, tons of providers. And I think people are wondering, why isn't the system changing? Do we live in a representative democracy?
Yeah. Yeah. No, very fair point.
Yeah.
So with Counterforce Health, can you talk a little bit about how it works? So, this is free for everyone. Is that in perpetuity or do you need funding? What's going on that front?
Yeah. So completely free for patients to use. We have gotten it grant funded. So thankfully, that's been really awesome. Long term, we're still trying to kind of figure out sustainability, but we have committed to completely free to patients forever. I'd like to keep it completely free to clinics forever too. But I think, of course, that'll go with saying of like, how heavy is the usage? Because the system does cost us money each iteration. I'll say in full transparency, what's interesting about AI is this. A lot of the cost is fixed upfront software development cost. So we just kind of ate that cost. We're like, okay, we want to build this as a tool. A lot of the patients and family caregivers using our care platform are experiencing these challenges. So we're like, okay, you know what? We'll just spend our own time and energy.
Yeah.
Per iteration of appeal, it is literally pennies. So we're like, you know what? If people light this up thousands of times a month, hundreds of thousands of times a month, who cares? Like, we have funding, we can just eat that. We can probably eat that cost for years, but if like somehow millions of people start using it, I don't want to go bankrupt. So then we started pursuing grants,
right?
And we're like, okay, now with modest amount of grants, we can now fund hundreds of thousands and even millions of people. So I think longer term on the patient side, we got it fully covered because most of the time patient needs once a year, a couple times a year, a few times a year. The clinics, interestingly enough, are blowing it up. In a good way, but also in a tough way, because if like thousands of clinics start using it and they're jamming 100 or 200 letters a week, at some point the costs are like really escalating. We're not there yet, but it's kind of like in the last month it's gone viral. So a lot of people are reaching out to us. So there we'll kind of like find a pathway to sustainability. I hope on the clinic side, it's actually creating a big improvement in the revenue cycle, because many times the clinics, especially like the smaller providers, and I think this goes back to the point of, even on the provider side, a lot of people used to be independent physicians, right? But they kind of give up when this administrative burden becomes so large. So interestingly enough, a lot of the independent clinics, they don't like to send stuff to collections if it gets denied and they did something for a patient and they can't pay, or the insurance said no. They'll say, please, can you pay? And then if they can't, they'll just eat it and they'll take a write-off. So for this, the clinic, it's really helping them where they're able to get a lot of their patients to win, the care that they needed and to be paid for by the insurer. So it's improving that revenue cycle. So we think there's a pathway over time that the clinics may just say, hey, because I'm improving my revenue cycle, I'll fund a bit of the work. And I'd like to kind of keep it that way where, people can pay as they can, but, we don't need to make them pay. We don't need that much money to make this survive. But I think that could be an awesome opportunity because the unsolved problem is in the hundreds of billions per year. The technology is not super expensive to build. It's not super expensive to operate. And then the more people use it, the better the technology gets. So, I'd like to kind of have it be a, fully sustainable project, but this isn't like, hey, let's try to extract a lot of money out of this. I think it's like, how do we solve a problem at scale? And then how do we find a thoughtful way to scale and build a huge thing that can benefit a lot of people?
Yeah. And it's great when a solution, not only are you helping people and you're reducing the burden and you're helping them actually get access to care that they need that doctors prescribe to begin with, but, you're also helping to generate revenue for doctors. Like it's not often that you actually are generating revenue for businesses and, fighting for the little guy, so it's a unique combination of things.
Who's the biggest surprising beneficiary, which I guess is surprising to me. I should have thought about it in advance. Pharmaceutical companies. That in 3 or 4 weeks, as we've gotten coverage, we've gotten flooded with inbounds from patient access and payer marketing teams at pharma, and it's solving a big problem for them because people have amazing migraine therapies out in the market, and they see the stats and they're like, well, all these doctors prescribe, but only 57% of the patients actually end up getting it. What happened? I don't know. I have a gap. And I'm like, well, I'll tell you what happened. People are flooding our site. And, we anonymize and de-identify all the data, but, there's a lot of learnings to be shared. So I actually think that, in the most optimistic way, but, I'm not kind of running this to see, hey, how can we profit maximize? But I think there's a way to get people whose revenue benefits directly from this, which are pharma and clinics and even hospitals, to kind of fund so that the benefit to patients remains free indefinitely. And I think that's a really cool way to both solve a problem and build a sustainable and scalable enterprise. And that's kind of our whole MO is how do you build social impact innovation that doesn't always rely on just kind of begging people for money and, always asking for donations, but also isn't just purely extracting from everyone interacting with it. So I think there's a, this is a way to build a foundation for a sustainable social enterprise.
Yeah. Oh, that's so good. And so with the evolution of the company, you mentioned that it went viral recently, and I want to talk a little bit about that because it's good news. Can you talk about the company, how you're featured and all that?
Yeah. Actually, Good News Network. So it's gone viral on a bunch of things. So, we got national NBC News nightly news coverage. They also wrote a super long article about it. Then we got some TV news coverage on we're based in Research Triangle, North Carolina. So ABC in our area, NBC in our area, a couple of news coverage in San Francisco, Atlanta, etc. But then Good News Network, which by the way, I love reading because oftentimes news is so dark. Sometimes we're just get all negative, if you just kind of read all the headlines of all the bad stuff happening. So I like reading Good News Network because it's nice to remind yourself that there are good people doing good things and there's good things happening in the world. So I read that and then they picked up the story, and they were just hey, this is awesome that insurers are using AI to deny patients critical care. And then there's people trying to fight back by building AI to help them. So they ran a story and that thing went absolutely viral. Then a couple of positive news authors on Substack picked it up. So it's the social, interestingly enough, we get kind of traditional media, TV news or newspapers, which is great. Yeah. But then when social media kind of picks it up, these websites, blogs, Substacks, LinkedIn, somebody posted about it on TikTok, then it really goes, and it kind of shows you where the audience is at. So I think that's been really awesome. So all this has happened in the last 3 or 4 weeks. So yeah, we're getting flooded with people asking for help, which is really awesome. It's an honor to help people. And you really realize the challenges that people are facing. A lot of impact investors are flooding us, which is really amazing, to see that there are people very mission oriented in this work. And I think, both from an impact perspective and from a financial perspective, I think investors realize this is a big unsolved problem. So if somebody can develop a scalable solution to the problem, I think there's a way to build large enterprise here. So that's been really awesome to see. And it's been heartwarming for me to see formerly as an investor that there are actually investors who want to fund stuff, but also make an impact, And I think that's really cool. It's kind of the best of both worlds. And then just also more media is reaching out to us. So if anyone out there is listening and they need help, fighting their appeal, we're happy to help them. But also if in complex cases, we're happy to then shift the focus of the media opportunity towards, your situation, because sometimes patients are leveraging the power of media to then get the insurance company to cover the care. And, it's sad that that's the world we live in, but you know what? Got to use every tool at your disposal.
Yeah. Sometimes you need the platform, and
exactly.
then it'll happen like that.
Exactly. Yeah.
So, this has been great. Is there anything that you want to leave with the listeners? Any calls to action or suggestions that you want them to hear?
Yeah, I say first big call to action. Happy to share my book for free. Insured to Death. So email me and I'll send you a free copy, or you can reach out in the show notes or hit me up on LinkedIn. But there's like detailed case studies in there and detailed templates in there. So if you're going through a denial yourself, there are tons of things you can do. Multiple ways you can appeal to the insurer, multiple ways you can escalate it to independent review, depending on what state you live in. A lot of the state insurance commissioners have their own kind of like playbook, and you can escalate it so that they have to appoint third-party independent reviewers to review your case. Ways to kind of like talk to counsel about this to escalate it further. And each step of escalation you take, the more probability of winning, including even strategy of how to present it on social media, how to get traditional media. All of these are tools at your disposal that you can use to improve your odds. So I'd highly suggest people to check that out. And then reach out to us. If you are dealing with this yourself, if you know friends, family members, other people who are patients who are fighting claims, and if you're a clinician, if you know doctors, nurses, people at hospitals, anyone who's dealing with this, reach out. We would love to collaborate. And then also, if you are or know impact investors who are interested in, backing cool social innovation that can not only solve major problems in society, but also scale rapidly and become like a huge enterprise, definitely reach out to us. We'd love to kind of collaborate with the right mission-driven people. And we think there's like a huge, huge opportunity here.
I think you touched on almost everybody that listens to the show, so that's great.
Nice.
I'm sure you'll be hearing from some people.
Yeah. I mean, I'd say I'd kind of end in saying, like, I'm generally a very optimistic person. I think that we are in like a very difficult period in our society and our history, and it saddens me to see a lot of young people turn very pessimistic. But I think I think legitimately we are experiencing and sitting through the failure of major institutions, and there is a complete lack of trust. So I think that we can just kind of burn everything down and then, go back to the Stone Ages, which, might happen. I hope not. Or we can kind of do positive things and use our mind and our energy and our combined resources to build better institutions so that people have hope and I think positivity for the future. So I've kind of been in this challenge myself, when I was taking care of my wife through cancer, dealing with all these denials. I've run the care platform where I see all these people struggling. And, I kind of view that as like, okay, how do you do something? Even if it's a small thing, and even if it's just helping one person, do something to create hope for one person, then to create hope for 10 people, then to create hope for 100 people, and then kind of like bring out a positivity and hope that things suck, but there's ways to do it, to create hope for a better future. And I feel like that way you can avoid a complete collapse of society and, full out anarchy. So yeah, I like to kind of, empower people to say that there is something we can do. You can do individually, you can do it together with other people, and we can do collectively as a society.
Yeah. And everyone listening, you can tell one person about this service, right? And then you can change their life, really. So perfect. All right. Well, Neal, thank you so much. This was such a fun series.
Thanks.
When you start another company, let me know and you put back on.
We'll do. My next thing I'm obsessed with is just like cancer and like the rising rates of cancer in young and middle-aged people. So I'm kind of toying with the idea already of how do we arm people to like kind of both take preventative action and then do a personalized risk assessment. I haven't figured out the exact path yet, but I think there's a huge thing. I've had so many, obviously in family, but also so many friends, struggle with like breast cancer, colorectal cancer, other forms of cancer in their 20s, 30s, and 40s. And I think there's like just something going on in society and environmental toxicity. But I think there's also preventative steps people can take. So I think that's going to be whenever this thing gets on a sustainable footing. It's like right now, I feel like spending a lot of time on. But yeah, I think there's something to do in there too, So yeah, I'm like very excited. But yeah, it's fun to do innovations and just solve unmet needs because I think there's a lot of cool stuff and a lot of people can do it.
Yeah. Absolutely. And I was just reading an article on that too. So we're always on the same page.
Nice.
Yeah.
Let me know if you want to collaborate. Yeah.
Absolutely. Yeah. All right. Well, thank you, Neal. And thank you,
Cool.
listeners. Please remember to subscribe and like and comment and follow Neal and Counterforce Health and also Care Yaya. And let's try to just squash burnout from the care economy crisis. Thanks, everyone.
Thanks, Patrice.
Bye.